After age 70, 7 signs your arteries might be clogged. A warning before a stroke or heart attack occurs. Introduction. Did you know that many heart attacks and strokes do not happen completely out of the blue? In many cases, the body sends out warning signals months or even years in advance. The unfortunate thing is that these signals are often very subtle. A little bit of leg pain while walking, occasional chest tightness, or sometimes feeling dizzy. Many people assume it is just a normal part of getting older. But sometimes, the real cause lies in arteries that are gradually narrowing or becoming blocked. Arteries are the blood vessels responsible for carrying oxygen-rich blood from the heart to nourish the entire body. When cholesterol, fat, and other substances build up in the artery walls over time, the passage can narrow. This process is called atherosclerosis. If a plaque grows large or ruptures, a blood clot can form and completely block the blood flow. When that happens in the heart, the result can be a heart attack. If it happens in the brain, the risk of a stroke. After age 70, the risk of atherosclerosis is higher due to the aging process combined with conditions like high blood pressure, diabetes, high cholesterol, and years of smoking. The good news is that the body often says. In today's video, we will explore 7 warning signs that your arteries may be clogged and what you should do to protect your cardiovascular health. Sign number 1. But not everyone recognizes it. You are walking fast, climbing a few flights of stairs, or carrying something a bit heavy. Suddenly, you feel pressure in your chest. Some describe it as if a heavy weight is sitting in the middle of their chest. Others feel a burning or squeezing sensation. What is notable is that is because when you exercise, your heart needs more oxygen. If the coronary arteries are already narrowed, the blood flow to the heart muscle cannot meet the demand. The result is chest pain, also known as angina. Not all chest pain is heart-related. Muscle pain, acid reflux, or other conditions can also cause chest pain. However, if the pain appears during exertion and if chest pain lasts more than a few minutes, occurs at rest, or is accompanied by shortness of breath, sweating, nausea, or pain radiating to the jaw or left arm. Sign number 2. Leg pain when walking that goes away with rest. Have you ever walked a few hundred yards and felt pain or cramping in your calves? After stopping to rest for a few minutes, the pain. This is a very typical sign of peripheral artery disease. When the arteries in the legs are narrowed, the blood flow to the muscles decreases. At rest, the blood flow might still be enough. But when walking, if the blood does not arrive in sufficient amounts, pain occurs. Many people mistake this for joint pain or muscle soreness. They buy over. If the condition persists, the person may be able to walk shorter and shorter distances. And in advanced stages, the pain can occur even at rest. This is a sign that needs to be evaluated by a doctor early on. Sign number 3. Feet that feel colder than usual or wounds that take a very long time to heal. Do you feel like one foot is always colder than the other? Or are your feet cold even when the weather is not? Another sign is small scratches on the feet that take a long time to heal. When arteries are narrowed, the blood carrying oxygen and nutrients to the skin and tissues decreases. The healing process also slows down. For people with diabetes, this risk is even higher. If you notice skin discoloration on your legs, persistent cold feet, thinning hair on your lower legs, or slow healing wounds, see a doctor. Sign number 4. Shortness of breath during activities you used to do easily. You used to walk around the park every morning without any trouble, but lately, even a short distance makes you stop to catch your breath. Or, many people think to themselves, I guess I'm just getting old. In reality, age can gradually decrease your stamina. However, if your physical capacity drops when the coronary arteries are narrowed, the heart muscle does not receive enough blood and oxygen. The heart's pumping ability can be affected. The result is that the body does not get enough oxygen during exertion. You will feel short of breath, easily fatigued, needing to rest frequently, no longer having the energy to do things you used to do. It is important to note that in older adults, shortness of breath is sometimes the only symptom of. Not everyone has typical chest pain. If shortness of breath occurs more often or is accompanied by swelling in the legs, chest pain, or a rapid heartbeat, see a doctor as soon as possible. Sign number 5. Dizziness or fainting for no clear reason. You are standing and talking. Suddenly, you feel your head spinning, your vision goes dark, or more seriously, you faint for a few seconds and then wake up. This is not a symptom that should be ignored. There are many causes of dizziness. Some cases are relatively harmless. But if the arteries supplying the brain are narrowed or the heart is not pumping effectively, the blood flow to the brain can drop. The brain is very sensitive to a lack of oxygen. Even a brief decrease in blood flow can cause lightheadedness, blurred vision. If you only feel dizzy when standing up too fast, the cause might be different. But if dizziness occurs while walking, sitting, or repeats many times, be proactive and get checked out, especially if the symptom. This could be a sign of cardiovascular disease or cerebrovascular disease that requires urgent medical attention. Sign number 6. Sudden weakness or not having enough energy for daily tasks. This is a sign that is very easy to overlook. No obvious symptoms. You simply feel like you are getting weaker every day. For example, you used to be able to carry grocery bags yourself. Now, even a small bag makes you tired. You used to garden for an hour. Now, after only 15 minutes, you want to sit down and rest. Many people think it is just old age. It is true that muscle mass decreases, but if the decline happens fairly quickly, the cause is not just age. When arteries are narrowed, organs and muscles do not receive enough oxygen-rich blood. This makes the body tire faster during activity. If you notice a clear decrease in your physical ability in a short period of time, talk to your doctor. Do not wait until a heart attack or stroke happens to start checking your health. Many cardiovascular diseases can be detected early. Sign number 7. Sudden difficulty speaking, facial drooping, or weakness on one side of the body. This is the most dangerous sign in today's entire video. If you or a loved one, slurred speech, unclear speech, not understanding what others are saying, weakness or numbness on one side of the. This could be a sign of a transient ischemic attack, or TIA, or a stroke caused by a blocked artery to the brain. It is important to note that some people only have symptoms for a few minutes and then return to completely normal. They think to themselves, maybe I am just tired. Maybe my blood pressure is low. But in reality, the risk of a stroke in the following days or weeks can increase if the cause is not treated. If symptoms last more than a few minutes or appear suddenly, even for a short time, do not drive yourself. Do not try to take medicine at home. In stroke treatment, every minute that passes can affect the number of brain cells that can be saved. Factors that cause arteries to clog faster after age. The process of atherosclerosis does not happen in a single day. It happens silently over many years. Several factors can make this process progress faster. The first factor is long-term high blood pressure. Constant high blood pressure damages the inner lining of the arteries. This is where plaques easily form. The second factor is high LDL cholesterol. Over time, the artery passage becomes narrower and narrower. The third factor is diabetes. High blood sugar over a long period not only damages small blood vessels, but also promotes atherosclerosis in large arteries. The fourth factor is smoking. Tobacco damages the vessel walls, increases the risk of blood clots, and reduces the amount of oxygen in the blood. The fifth factor is a sedentary lifestyle. Sitting a lot. The sixth factor is a diet high in saturated fats, sugar, and salt. Eating too many ultra-processed foods, fried foods, and sugary drinks over a long time can increase the risk of heart disease. Finally, many people see their blood pressure or blood sugar stabilize and decide to stop their medication on their own. This significantly increases the risk of cardiovascular complications. How to protect your arteries after age 70. The good news is that although age cannot be changed, many risk factors can be controlled. The first thing is to maintain your blood pressure within the target range recommended by your doctor. Do not stop. Second is to control your cholesterol and blood sugar. If your doctor prescribes cholesterol-lowering medication or diabetes treatment, follow the instructions correctly. Third is to exercise. Walking for 20 to 30 minutes a day, if your health permits, can help improve circulation and support heart health. Fourth is to eat a heart-healthy diet. Prioritize green vegetables, suitable fruits, fish, beans, whole grains, and limit ultra-processed. Fifth is to not smoke and to limit alcohol. Even at an older age, quitting smoking still brings clear benefits to the cardiovascular system. Sixth is to maintain a healthy weight. Losing weight if you are. Finally, have regular health checkups. Blood tests for cholesterol and sugar, blood pressure monitoring, and cardiovascular risk assessments can help detect problems early before complications appear. Summary. Healthy arteries are the foundation that helps the heart, brain, and entire body function normally. When arteries gradually narrow, the body often sends out warning signals very early. Today, we have explored 7 signs that could indicate your arteries. Chest pain or pressure during exertion, leg pain when walking, that subsides with rest. Cold feet or slow healing wounds. Shortness of breath during activity. Sudden difficulty speaking, facial drooping, or weakness on one side of the body. The most important thing is not to dismiss these signs as just a normal. Thank you for watching the video until the end. If you found today's content helpful, please share this video with your family and friends, especially those over 60 or 70, so more people. Don't forget to like, subscribe to the channel, and turn on the notification bell to continue joining us in our series on senior health. Note: the content in this video is for informational and health education purposes only and does not replace the advice, diagnosis, or treatment. If you or a loved one experience symptoms suspicious of a heart attack or stroke, call 911 or go to a medical facility immediately.